Hello, everyone. Today, I want to talk about differences in services. I know I see this online a lot where parents are asking what state is a good state to move to for services when you have a child on the spectrum. So I think I'm probably in the right place to speak about that, moving from Florida to New York City. But before I start comparing the services, let me just say the number one states that are very, very good for autism services, I would say New York City and Massachusetts are probably equal when it comes to being the number one state. I know some parts of California is pretty good. New Jersey's good. Pennsylvania has some good services. There are other states where certain families feel as if they are content with services such as Maryland, Ohio, and if you know any other states, or if you are in a state that works for you and has everything that you need, you can drop it in the comment section. But for me, I have a child, a neurodivergent child with high support needs. Therefore, the state of Florida, where I was, it didn't work for us at all. I was fighting for every single services under the sun. I was fighting for school services, for OT services in school. We never had that. They told me that he didn't need it. We had speech services that was probably, I think it was 1 to 2 times a week, but then that had stopped because of due to staff shortage, so that had stopped. I was fighting for a one-on-one para. I never got it. I was trying to get Medicaid, but we were denied for Medicaid my because they told me that my income was too high. Therefore, we were not qualified for Medicaid. There was at a point in 2018, if I can remember correctly, we were paying $350, I think, every month just for ABA services, because at the time it was we were using my employer's insurance. So that was crazy. But we weren't able to have Medicaid because my income was too high. I tried to apply for the Medicaid waiver, which is through the APD, the Agency for People with Disabilities, and I tried to do it under the crisis category for my son. And someone came into my home, they did their assessment, they saw my son. Even after they saw my son and did the assessment in our home, they declared that he wasn't disabled enough, he was not, I guess, autistic enough to receive services under the waiver immediately. There was a wait list, and I think the wait list is about 10 years before you can start receiving services. So it really was a nightmare. Really was a nightmare. We were waiting for ABA. We had ABA services, and then something happened, and then I was put on the wait list. We were waiting for ABA services, and I mean, a year had gone by with no therapy. A year and a half had gone by, and I was on multiple lists of services. So it was crazy. I was getting calls all the time. My son was getting suspended all the time. It was crazy. It was a nightmare. I didn't feel supported at all. So in Florida, Medicaid was based on a family's income. So when I got to New York City, I will tell you exactly the different steps that I took to start getting the ball rolling. But even when I was in Florida, with moving to New York City, I did a lot of research. I made a lot of phone calls. I participated in parent support groups that were in New York City. I used a New York City address. I got in contact with, school people who were directors in schools, people who were in charge of different programs, because I wanted to really get the ins and out, and I wanted to understand what other parents were saying, what kind of services they were receiving, what they were happy with, and the things that they were not, they were unhappy with. So one thing I remember was in those meetings, all the parents, whenever they would talk, they would say, my care manager, my care manager. And I'm like, wow, that's amazing. Everybody talks about their care manager, how, you know, their care manager does this, and their son has this, their daughter has this, and all these services. So I was really excited about coming, and so that I can start using that same language. So when I got to New York City, I didn't work for a couple of months, because I thought, you know, if I didn't work, I didn't show a specific type of income, maybe that will help with getting on Medicaid for my child. But I learned that is not the case because in New York City, Medicaid is disability based. It's not really income based. So my son was able to qualify for it based on him having the diagnosis of autism. So I applied for health insurance, and through health insurance, we were able to get home health services, and it took us within 2 to 3 weeks, we got a call from an ABA company, and they were already coming into the home to do an assessment and begin ABA therapy. Then speech therapy in the school, then OT in the school. So one thing I can say is that the schools in New York City, they assess your child and they say, oh, they need X, they need Y, and they need Z. They need all of that. So he's getting speech in school, getting OT in school, and then we are now receiving home-based services where he's also getting OT at home, he's getting ABA at home, and will be getting speech in the home as well. In the school, he has a paraprofessional that goes with him throughout the day. And on the bus, he also has his own para on the bus that travels with him without any issues. The school is very communicative. They communicate everything with me, everything that goes on into the school. And they are very receptive to the things that I would like for my son to have in school, the things that I would like him to be able to do in school. They tend to really work with me. I don't get calls at all about, you know, my son's behavior or any issues like I was having in Florida. So I would say so far the experience has been really, really wonderful. Another thing that I did when I got to New York City was I applied for the transportation. What is it called? Access a Ride. Yes, I applied for Access a Ride. So when it comes to appointments or anywhere that we have to go, we can use Access a Ride to do that. I've also applied for something that is called OPWDD. And with that's kind of like what I guess in Florida they would consider as the Medicaid waiver services. And with OPWDD, there are lots of support, lots of services, respite care, community-based services, home-based services. There's day habilitation. There's tons and tons and tons of services. There are sleepaway summer camps. Whatever level your child is at, there are different programs. There are tons and tons of resources. You do have a care manager that works with you, that is in charge of managing the services for your child. So it's a really, really different experience. It really, really is a different experience. So I wanted to do this video. I didn't want to talk too much, but if you have any questions, if you're pending a move, you can contact me.